On October 20th, 2025, the courtyard of Nkhata-Bay District Hospital was filled with anticipation. A 40-foot container packed with medical equipment and supplies worth 2.5 billion Malawi kwacha had arrived. From health officials to village elders, from frontline workers to community members, everyone gathered to witness a moment of renewal. It was the 90th delivery under Malawi's 100-container healthcare service strengthening initiative. As the container was opened, the crowd leaned in. Inside, HDU beds, patient monitors, X-ray and ultrasound machines, surgical kits, maternity and emergency care equipments, PPE, and laboratory supplies. Dr. Topsim Dolo spoke first, outlining how equipment would ease pressure on staff and improve patient outcomes. Reverend Maxwell Mazua, Patriots chairperson for Nkhatabay, emphasized community ownership. Mr. Gondwe reaffirmed government support. Mr. Chiwambo spoke of the Malawi's initiative commitment to equitable health access. And finally, guest of honor, Senior Chief Nyaluanga, called on all stakeholders to protect and steward the donation. Project Cure provided the medical equipments and the Islamic Relief USA funded the shipping. The Malawi initiative, led by Professor Edward Mbewe, coordinated mobilization from the US with support from the Malawi Embassy in Washington under Embassy Esme Jombo.
Fellow Malawians, time has come when we must begin to ask ourselves what can we do to help our country move forward. This is simply the beginning. We knew F00T putting money to Malawi, but we felt, let us prioritize the health sector. Because it's only healthy people that can be productive citizens. Kama tunakatwala usukuru sakabine shindo imaima kitu geni imaima so sisi imaima ifesiku na yenyewe nadhani kwa tunaendelea yani 40 foot amene mazoma container that is a pure 40 foot container and it is full to the brim. Sasa za mtajisije nene mtamu ni mabedi ya ICU is kama mtamu mabedi hapa specific. So if you have a baby that you have so we have things there. And our faithfulness in making sure we properly utilize the benefit to land akumusu kwa alalalika kujulani wengi. Kwa if we decide ya kuma sometimes you are looking at the private hospital, but you are looking at specialized treatment. When you have these over, very little who cannot afford who have the private clinic. They are unfortunate and they die in this.
Actually, video Patriots is having or showing devotion or support to one's country. Right? What I've done here. And this, let us continue supporting them. Let us continue maintaining this have done a big thing to us. You know what I mean?
The Patriots of Malawi, chaired by Mr. Kamuzu Chiwambo, ensured readiness, accountability, and community engagement. This work is supported by the Malawi government through its agencies: the Ministry of Health, Ministry of Local Government, and the Malawi Revenue Authority, all ensure smooth deployment through customs, waivers, and coordination. This is what transformation looks like: one container, one hospital, one community, and a nation rising together.
We are going to sensitize our people on the importance of protecting our programs, especially public assets in the hospitals. We can't survive without hospitals. Therefore, we have to look after all those things that are in our hospitals. On top of that, as chiefs, we are the custodians. We are supposed to see that our people are living their life. If I need advice in such a it means I'm no longer here.
So this should tell us that the equipment we're receiving is of high standards, is high equipment. And some of these beds that you see when you visit the warehouse are here to complement what government is doing. Because, I mean, let's face it, even government is facing problems. But with this kind of equipment, now it means the job of the government is also lighter. But we also want just to acknowledge there are so many people that we're working with. As I said, it's a big coalition. This is not the work of one person, with our embassy in Washington, my Westman Chombo and that team.